All right, everybody, welcome to the talk, Top Medical Questions About Vaginal Steam. Many of you know me. My name is Keli Garza. I am the owner of a company called steamychick and the founder of the Steam Hydrotherapy Institute, which is the first and only institute in the world dedicated to researching the benefits of vaginal steaming. And I also train and certify steam practitioners. So, this over the past year, I had the amazing opportunity to travel to several different countries and speak to doctors and nurses in those different countries about steaming. And in some of the places, and we'll go into a little bit more, steaming was commonplace. In other places, it's not so commonplace. So over the past year, I've talked to doctors in Mexico, the Czech Republic, Korea, and Palau. And the conversation about steaming with doctors is different in these different places. But what I noticed in the USA, there are a lot of questions and by doctors and nurses. And I noticed that these questions are repeated over and over again. And I don't think that there are good sources of information about some of these things. So I decided to do this talk to kind of pull it together, these questions, as well as put the answers all in one place for somebody who is interested in learning more about it and who wants to get those medical questions answered. Okay. All right. So there are three topics that I want to go over. One are models of steam care in medicine. Number two are the steam research studies. And then after that, the doctor's questions. And I want to go over those first two topics because I think that they help to give a great context for those questions. All right. The first thing that I want to do is talk about models of steam care in medicine. To tell you the truth, there's not much. There are only a few places in the world where steaming is offered like hand in hand with what we acknowledge as conventional Western medicine. So the two places that I know of are in Korea and in the Czech Republic. So I want to actually show you guys some pictures of what steaming looks like in those countries. I compiled a couple photos. The first one is in Korea. So this big building right here is Kyunghee Hospital. And the second story of the building, there's a picture of me right here next to the sign. And you'll see that the sign says Herbal Steam Therapy Room, number 1. And there was actually a second Herbal Steam Therapy Room right next to it. So long story short, I never actually made it into that Herbal Steam Therapy Room. By the time I got there, it was closed. And it was locked up, so I wasn't able to see what was in it. But I did go to another clinic that's associated with this hospital in a different location that's known for being a gynecology clinic, as well as they specialize in reproductive endocrinology, so fertility. And this was what the steam setup looked like there. I don't know if this was, I don't think this is actually where they do the steam, but this was out in the waiting room for people to see what this treatment looks like. So this is the example of, so this is what I'm thinking might be in the hospital steam room. And then I also went to a spa and I did some type of a detox treatment. It was mainly like a foot detox treatment, but we were sitting on these chairs. And there was no steam rising from this chair, but there was clay and some other minerals, I think some salt and some charcoal that were sitting there, and it was heated with infrared. So this is another example of something that could be used I did ask them if they use this chair for steaming. At that location, they don't, but the chair can also be used for steaming. So that's an example of what I found in Korea. Now, I actually was under the impression that that steaming was used more commonly in hospitals and clinic settings. But from what I found, this hospital is special, and that clinic is special, that they specialize in steaming and offer it for their clients, for their patients, actually. And then the other photos that I have on here for you guys are the photos in the Czech Republic. So in the Czech Republic, there is a really smart company, medical supply company, who created this. They call it the medical steam chair. It is really nice. It has a place for the pot to be placed under the stool, and it is has holds a lot of weight. It's made out of steel, so a really nice medical steam chair. And here we can see it actually in the labor and delivery room. And that's a midwife that is walking by. And she's the one who, when I was there, she did set up this steam stool for one of the clients. And also on the counter back here, you can see there's a cover that they make as well. And they used medical material to make this cover. So everything can be disinfected and wiped down according to the hospital standards. And here we actually have a picture of a woman steaming in the labor and delivery room. The way that they set it up is right at the foot of the bed. And this woman she was like 38 and a half weeks pregnant, and she was coming for a checkup. And so instead of just doing the checkup, doing like blood pressure and talking to her, the midwife offered her a vaginal steam session, and the patient wanted to do it, so they set her up right here, and she was able to just relax and take 10-15 minutes and do her session. She leaned forward and they put some pillows at the foot of the bed, so she was able to lean forward and relax as well. Okay, cool. Yeah, so that's what steaming looks like. I mean, I had to travel across the world to find it out. And it was really exciting. It was really exciting to see steaming, honestly, with professional, nurse midwives and with doctors overseeing it, obstetricians and gynecologists who were all part of what was going on. It worked very well in a medical setting. It wasn't something that seemed like, I don't know, let's see, foo-foo, or hippie. It was definitely, just something that fit in really well and seemed to, offer a lot of value to the patients. So one thing I didn't mention yet about the Czech Republic was that in the Czech Republic, steaming is now used in the labor and delivery department of over 30 hospitals. So this is probably the only place in the world where steaming is that widely accepted and dispersed throughout the medical care system, specifically with regards to steaming for labor during active labor and for labor preparation. So one of the nurse midwives that I spoke to in the hospital, she said that at first when they introduced it, the doctors and the other nurse midwives, weren't quite sure about it. But there is a system in the Czech Republic where the doctors, or at least this current generation of doctors, believe that in something called physiological birth. And so what the way that they, practice is that they work hand in hand with nurse midwives in the hospital. And the nurse midwives, they work with them and let them do whatever they want to do for the labor to naturally progress. So it's only if there's complications, then the nurse midwives get the doctors involved, and then the doctors might help with medical treatment options. So the nurse midwives are the ones that were able to introduce the steaming. And one of the nurse midwives, after a year, she noticed that when she was doing her stats, at the end of the year, she noticed that ever since they introduced steaming, she had been writing 50% less prescriptions, because she's the one that writes all the prescriptions for Pitocin and for the other medications, like pain medications that are used. And they were using 50% less epidurals. So their overall stats had improved quite a bit. And she noticed that there was a reduction in episiotomies, transfers to cesarean, as well as they were having an increase in customer satisfaction. People were coming and seeking them out specifically because of offering steaming. So when she shared this with the rest of the, OB department team and the doctors, it really helped to get more people on board. And now they offer steaming to everybody. And almost everybody elects to do steaming, unless there's just not time to do it, unless they just, don't have time from when they check in to when they actually deliver. So there's steaming for labor preparation and an active labor in a lot of these hospitals. And the statistics that they're seeing are incredible. I talked to a nurse midwife and obstetrician in another hospital in the Czech Republic, and they said that one of the statistics that they were really trying to work on was their episiotomy rate. Their episiotomy rate was, I think, at like 50%, and then they got it down to 15%, and that's what they were at. But ever since they introduced steaming, I think like 4 years ago, it's come down to only 6%. And actually, there hasn't been enough studies done. There hasn't been enough analysis done to see if those 6% of episiotomies were patients who had done steaming or not. It seems to be the trend that the patients who do steaming don't need that type of intervention at all. So it's really incredible. There's more work to do as far as understanding and analyzing what's going on with the steam clients, the steam patients versus the non-steam patients. But they've had really incredible results. So the last thing about the Czech Republic is that there is a fertility clinic who has also started offering steaming there, and she's noticing incredible results with the patients who choose to steam. They seem to be having a higher success rate of not only getting pregnant, but carrying those pregnancies full term. So that was really exciting and interesting as well. Okay, so that's where we currently have steaming working in medical models. Okay. I want to take a moment and go over the STEAM research studies. I'm not going to go over a ton of information about the studies. I'm just going to give you guys some basics. If you go to my website, steamychick.com or steamychick.institute, there's an area called Steaming 101, and it gives on the menu it says research. You can go there, and I have research studies published there so that you can read the full studies of everything, but I'll just give a summary now. So I am going to pull up the whiteboard again. The first study that we're looking at is vaginal herb use and chlamydia trachomatis infection. So chlamydia infection, a cross-sectional study among women of various ethnic groups in Suriname. And so this study was looking at, if you look at the objective, it says vaginal steam baths with herb leaves, herb use is practiced by some Surinamese women. And what they wanted to find out was this herb use or vaginal steaming associated with a higher rate of chlamydia infections. And so what they did was they included 1,040 women from Suriname. And part of the study was just a survey, just understanding who was using herbs, who was steaming, and which different ethnic groups were using it. And then they also did a cross-examination to see whether or not the people who were using steaming had a higher rate of chlamydia infection than the people who were not using steaming. And what you have to understand is that these researchers actually believed that people would have a higher rate of infections. Yeah, so that was the prejudice that they were coming into this to this study with, and part of this has to do with some of the media articles about steaming and some of the medical opinions that have been published out there talk about that steaming could be could cause a higher rate of infections, and so I believe that this study came out of that, right? And so researchers were like, okay, so if steaming is going to upset the vaginal microbiome, which is going to cause people to be more at risk of infection. And so this was the first study that came out, and it was published in 2019, that tried to prove that. But when you look at the conclusion, it says, the last line, vaginal herb use was not a determinant of chlamydia infection. Future research should focus on the effect of herb use on the vaginal microbiome and mucosal barrier. So they gave their recommendation for future research, but basically they did not prove what their hypothesis was. Their hypothesis was that people who steam, vaginal steam users, would have a higher rate of chlamydia, and they did not find that to be true. So this is the only study that has that was done with a group this big, 1,040 participants. And it is published on PubMed. It doesn't use the word vaginal steaming in the title, so I don't think that a lot of doctors and medical professionals that are looking for studies on steaming, I don't think a lot of them find it because they simply just say herb use, but they are talking about vaginal steaming. Okay. So the second study that I want to talk about was just published in 2022, and it is also on PubMed. And these are the only really significant studies about steaming on PubMed. The second study is, the title of it is The Association Between Vaginal Hygiene Practices and Spontaneous Preterm Birth, a Case Control Study. So this study, it included 79 people who had miscarriages and then 156 people who had full-term births. And what they were doing is they were looking at the vaginal hygiene practices between these two different groups, and they were trying to determine if certain hygiene practices were associated with a higher rate of preterm births or miscarriages. So they didn't just look at vaginal steaming. The practices that they looked at were washing with vaginal gel, douching. They looked at washing with soap, and they looked at vaginal steaming in particular on this study, and they called it vaginal steaming. So the researchers in general, they said that the reason why they did the study was because they're saying that recent studies have found that bacterial vaginosis, a disturbance in the vaginal microbiome, is associated with spontaneous preterm births. So they hypothesized that vaginal hygiene practices can alter the vaginal microbiome and are therefore associated with a higher rate of miscarriages. But there's no studies investigating it. So again, they came into this study prejudiced, thinking that vaginal steaming was going to alter the vaginal microbiome and cause now a higher rate of miscarriage. So that was what that's what they thought was gonna, that's what they thought. That was what the reason why they studied it. And at the end, they said, if you look at the methods and findings, if you look at the last sentence there, it said no association was found between vaginal steaming and spontaneous preterm birth. So they just weren't able to find a connection. There was no connection. So, and then their conclusion, actually, they found that out of all of the things that they looked at, using vaginal gel was associated with a higher rate of miscarriage. And so then they said that people should be informed that the use of gels might not be safe. But again, vaginal steaming didn't have any association with higher miscarriages. So I'm gonna close this off and come back to you all. So the interesting thing there is that both of these studies, which are published on, in medical journals, both of them found that steaming was not harmful, even though the researchers were trying to show that steaming would be harmful. So those are the significant studies there that again are published in peer-reviewed journals and have the right research methods that are accepted by conventional Western medicine. Now, there are more studies about steaming that have been done internationally. With lack of any other information, these studies are useful in that they give us some ideas about what's going on, how doctors are treating steaming, how researchers, what kind of findings researchers can find, as well as some ideas for the research, the existing research out there on how steam practitioners and patients are experiencing steam. So a quick rundown of these studies. The first that I'll share with you guys is that there was a study done in India. This study had 50 participants, and they used steaming for postpartum recovery. And they steamed, 25 of the women were steamed, 25 of the women were not steamed. And the steam group steamed for 7 days in a row. And so they had medical exams on both groups. Then you had the steam group steam for 7 days in a row, and then they did medical exams again in order to compare. And so what they found in the study was that steam showed analgesic and anti-inflammatory properties, pain relief, antimicrobial effect, decreased risk of infection because of accelerated lochia expulsion. Steaming supported faster uterine involution, so the steam group's uterus went back quicker. They found that the steam group had an improved pH balance. They did vaginal swabs before and after, and it did not disturb or kill any of the healthy vaginal flora. So that's what that study found. I think it was a very significant study because they did and tested so many things. Then there are actually a lot of studies that were done in Korea. In Korea, there are actually more studies that have been done anywhere else in the world. And these are just the ones that I've been able to read in English. So the first study that I'll share with you guys was a study that was done on steaming for cervical cancer, stage 1 and 2, and with HPV. So this study had 80 participants, and what they found as a result of the study was that the steam group had a higher tumor-free survival rate. So they had more of the steam users were tumor-free. I think they did it after 4 years. They were looking at it. The steam group had a lower HPV positive rate, and they had a lower pelvic lymph node metastasis rate. Okay, so the steam group did a lot better with the cervical cancer and with the HPV going away and staying away than the non-steam group. Another study to be aware of was one on atrophy, and this is one of the questions that somebody sent in ahead of time. They wanted to know about the benefits of steaming for postmenopause. One of the things that postmenopausal women deal with is vaginal atrophy. And so they did a study. I forget how many participants were in this one, but you guys can go to my website and I have the studies actually also. I have the full text of the studies as well as summaries. And so the steam group who was steaming for vaginal atrophy actually had 93 to 99% 93 to 99% of their symptoms were resolved as a result of steaming. So that's a really, really high rate of symptom relief. 93 to 99% of all of the symptoms for vaginal atrophy patients went away and were resolved as a result of steaming. So really effective. And I've seen that in my, clinical practice as well. Leukorrhea. Leukorrhea is like discharge, as like yellow, green, or white, thick white vaginal discharge. So there was a study on leukorrhea, and this study had 16 participants. 7 of them had active vaginitis, so an infection. In this study, 100% of the participants had a decrease in the symptoms. And I think it was the majority of the vaginitis was completely gone. There were still some symptoms in some of the participants, and then some of the participants had no symptoms at all, but 100% had a decrease in the severity of the symptoms. Pretty incredible results. Menstrual cramps was another study that was done. And these were all done by different universities, by the way. So there was a study done on menstrual cramps. This one was done by a college of nursing, actually. And what they found was that the STEAM group had significantly decreased menstrual cramps. What they did was they worked with people who complained of period pain, and they had them steam for 4 days in a row prior to their period, and they had them rate their pain and menstrual cramps before and after, and they found that the steaming significantly decreased menstrual cramps, and therefore recommend that all nurses are trained in steaming in order to provide that relief for any patients that complain of menstrual pain. Then we had a study on Candida vaginitis. So this study showed that steam was an effective treatment. Now this study is interesting because it was a literary review, and so they were looking at the different studies on steaming for Candida vaginitis. Now I haven't seen those studies, so I assume that they're only in Korean. And they found that there were 5 studies that did show that steaming is quite effective, and that they had, control groups and proper techniques, research techniques. And so this study was a literary review calling for the need for more studying on it. But they did find that steaming was an effective treatment for Candida vaginitis. Okay. And then the last one was the endometriosis. The endometriosis study was actually just had 1 participant, and the participant had endometriosis and did surgery to remove the endometriosis. And then it came back. So she did surgery again. And then the endometriosis came back. And so she did the surgery again. So in each case, she did 3 surgeries, each 1.5 to 2 years apart. So that's how fast the endometriosis was recurring for her. So what they did was after her 3rd surgery, the researchers decided to see if steaming could prevent her endometriosis from returning again, and the need for an additional surgery due to the endometriosis. And at the time that they published the study, the patient had gone 34 months without the recurrence of the endometriosis. So in every other case, she hadn't gone a full year without the endometriosis returning, but in this case, she went almost 3 years using regular steaming. She was able to prevent the endometriosis from recurring. So a really incredible study with, again, just following 1 patient on her use of steaming. All right, so those are the main studies I think that are out there that you can read. In addition to that, I did a trial study called the 4th trimester vaginal steam study. There's not significant sizes, but we did what we could. It has 12 participants, and half of them steamed and half of them didn't steam. And we looked at their postpartum recovery. Again, really incredible findings and results for the STEAM group. But of course, the study needs to be done on a larger level. I think the main findings were that our STEAM groups blood pressure and blood rate came down, and heart rate came down significantly more faster and to safer zones than our non-STEAM group, whose blood pressure and heart rate went up, actually. As well as we saw, faster uterine involution. The uterus went back down to size. We saw a greater weight loss in our STEAM group and some different things like that. So you guys can check out that study as well. And then beyond these studies, what we have, the majority of information we have about steaming is anecdotal. So, for example, I use steaming, the first time I used steaming was to bring back a missing period. The next time I used steaming, I found out that my fibroids had gone away. I had 3 fibroids and they went away. And I believe it was because of steaming. Then I used steaming when I was overdue and I didn't want to get induced. So I went home and I steamed and my contractions started, right? So I have my own experience with steaming, and so do a lot of other people. Steaming is universal. It's been used all over the entire world in women's health since it looks like the beginning of time. There are records that go back as far long as you go back that you have records of women's health. You can find records of steaming and steam remedies and herbs used for steaming. So the majority of the information that we do have about steaming is anecdotal and looking at how women are using steaming and what their experiences have been with it. We don't have enough, I think, systematic way to collect that anecdotal information since most doctors don't even know about it and are not keeping it as part of their medical records. But I created a database called the Pelvic Steam Testimonial Database in order to collect people's individual STEAM experiences. So if you have one, for example, you can go to the Pelvic Steam Testimonial Database and contribute what your experience has been with steaming. And it's really, really interesting to read all of the different reasons why people try steaming and what different results that they have. So that's a great resource. There's over 100 different testimonials of steaming there. And then on social media is interesting because, people have started sharing their steam experiences on social media and the results that they've had. And I think a lot of this is in trying to help other people. I'm like, hey, I had this problem. I used steaming. I had this result, and you should try steaming. And then there's also spas. A lot of spas who are offering this. Steaming has become very popular in spas in the United States. Actually, in Korea, steaming is very popular in spas. It's actually way more popular in spas than it is in medical use. And so that spa use of steaming is something that also has promoted some of the different things that steaming can do, even when it comes to medical concerns. So that's the information that we have. So that's the intro. I'm going to do my best to answer these medical questions, and you guys know that this is where what information we have, what the source of that information is. Okay, so Melinda has a question. She said, did they document which herbs were used in each of the studies? Yeah, most of the studies did. Even my 4th trimester vaginal steam study, we write out exactly which herbs were used. The Korean studies are amazing. I love looking at what herbs are used. A lot of them I'm unfamiliar with, and they're in Korean language. But yeah, there is information about which herbs are used. Isabel has a question. What do you think about postpartum steaming with someone presenting big fibroids? Would there be a higher risk of excess postpartum bleeding? All postpartum bleeding all postpartum steaming has the risk of bleeding. And so I think it's important to do it with a certified steam care provider who is trained in postpartum steaming. They're going to know when it's safe to steam and when you have to stop. So it may be safe to steam today, and then you might need to stop tomorrow. It's something that I train like my Steamcare providers to follow and check in with the person on a daily basis, and to be able to read what's going on with the lochia and how the body's responding to the steam. So what you could do is you could wait until all bleeding has stopped, steam. If the bleeding starts again, wait until all bleeding stops and steam. That isn't how steaming was used in any of the studies. The 4-trimester vaginal steam study we did, we were steaming with people on postpartum days 4 through 8, and they were all had lochia. They all still had lochia. The same with the Indian study. Steaming is used by midwives and birth care workers around the world, and also family members in different cultural settings where steaming is used for postpartum, and it's often used very early on. And I think there are a lot of benefits to using it early on, but you do have to work with somebody who knows what to expect and when steaming should stop. And then I train my practitioners to have first aid to stop bleeding on hand when working with postpartum mothers. And thanks for these questions, guys. Okay, so the questions that doctors ask. So I just want to give some context here. There are doctors and people who hear about steaming and think it's ridiculous, okay? Never in their lives will they try it. They think anybody who does it is insane, and it just sounds like just like complete foolery. I don't know, what or why. I don't know if it's because we use the word, vagina in it for vaginal steam, but that's a real reaction that, people have, and they will never, they don't need more information about it. They've already made up their decision. And then there's, probably like many of us on this call, people who have had their own experiences with steaming, think that it's a great idea to use to try to, for our health, right? And just want to keep on learning more about it and understanding how to use it, right? So, we're in the, this category. And then I think the majority of people in the world, and a lot of more doctors are in this category than I think a lot of us realize, are just like, what is that? Like, and just have some questions about it. And how we, whether or not we're able to give certain information, is going to influence, the opinion and that they come out of, the opinion that they form, on steaming. And so I'm going to do my best to answer. There's kind of like 2 questions that doctors always ask. And so the first one just has to do with what the steaming procedure consists of. So one doctor, the way that he asked it, he said, is it just steam? Is there pressure involved? How does the steam get into the uterus? In reference to helping issues like fibroids and endometriosis. He's like, I just don't understand how steaming is getting into the uterus to impact those things, right? And then I've heard this question repeated over and over again. So again, I think it's a great question, and I'll do my best to give at least my answer to it. So steaming doesn't have any pressure involved. It just involves sitting over a pot that has water in it, that has been heated to the point that it's steaming. And that steam is just naturally rising. Now, steam naturally actually does have some lift power and some energy that's part of it. So, but there's no additional pressure that's being added. When we're talking about the steaming, that has been done since the beginning of time, this ancient women's practice, there's no pressure involved, okay? As far as how steam gets, so there's different ways that steaming can happen. One is squatting over the pot or having the knees on either side of the pot and having the pot in the middle, like if you have your knees on either side and the pot here. The other way that it could be done is by sitting on a stool or sitting on a chair made for that purpose that has the pot under it, and the stool or chair would have a hole in it. And then there's special sauna boxes that are made for it that have a hole in it. Those ones are a lot hotter and, nice. And then there's people who do it just in the toilet. In fact, several of the hospitals in the Czech Republic, if they didn't have those special medical steam stools, they were actually doing toilet steams. So another way that it can be done in medical settings, like for example, in the fertility clinic in the Czech Republic, they were just using a geriatric chair. Yes, a geriatric medical chair stool that would be used, and they just removed the plastic, like bowl, and just had a steam pot underneath. So these are some of the different ways that the steaming, can be set up and the way that it looks. Okay. Another thing to take into consideration is that when I'm talking about steaming, for example, I'm talking about both wet steaming and what I call dry steaming, which is basically like smoking, right? So you can, we have the steam that you do with water, and then there's also another practice that, I don't know, I consider the same, basically, but it's where you take the herbs and you burn the herbs and create smoke and then sit over that. So, so all around the world, when we're talking about steaming and we look at the practice of steaming, sometimes it's actual steam done with water, and sometimes it's actually the dry form done with herbs. I try to always find a term for it. I don't think smoking sounds right. Like herbal smoking or vaginal smoking just doesn't sound right. So that's why I just call it dry steaming. I don't speak Korean, but my understanding in Korean is that there's kind of like one word, and then you indicate if it's dry or wet. And so that's how I kind of created that terminology in English. We do have a word in English, an old word called fumigation, that refers to steaming. When you look at like old medical records and translations, a lot of times they'll talk about fumigation in reference to one of these steam practices, either with steam or with smoke or with the dry herbs. So before I talk about how the steam is impacting conditions that are in the uterus, I just want to talk about what's actually all of the other places that steam is touching before you even get to the inside the uterus. Okay. So the external genitalia. Okay. I do have a photo of this. Here's a photo of the external genitalia. These are all the places that steam hits without even needing to do anything, without even needing to get in the uterus. So the first thing is, this question that asks, how does steam get into the uterus, is also just not understanding how many things people use steam for that are on the external genitalia. So I don't know, if you guys want to, sorry, let me zoom in on this. So for example, the list that I have, things that steaming is useful for, lesions, warts, vulvovaginal cysts, or also known as Bartholin cysts. They're right there. Anything you can touch with your hands. These are areas that the steaming is topically touching, right? Paraurethral cysts, these are the cysts on the side or near the urethra. Clitoral cysts. So, right up at the top, you can have a clitoral cyst there. And Michaela, you asked about this area. And so I just want to say, again, anything that steam can touch, if it can touch that area, most likely it can help resolve something in that area, especially if heat, draining, or circulation are going to be helpful to resolving that concern or that issue. Ulcers from, say, herpes or anything else, any kind of rash in this area or discomfort. And then the last one that was a really significant finding in the 4th trimester vaginal steam study was sutures, the healing of sutures. We had our steam group and our non-steam group. We were looking at whether the sutures were itchy, stinging, uncomfortable in any kind of way. And our steam group had no stitch discomfort after their steaming from day 8 postpartum, whereas our non-steam group continued to have discomfort from their sutures at 6 weeks postpartum. 6 weeks versus 8 days postpartum after 5 steam sessions. I mean, that's a long time to have a problem and discomfort in that area, the type of pulling, itching, and infections in that area. So that was a huge, difference that the STEAM group experienced versus our non-STEAM group. So much so that the midwife researcher who did the study, the exams, she felt so sorry for the non-STEAM group that she basically chose never to work with, postpartum clients who don't steam. And in this case, these were people who were unaware of steaming and they were our control group, but it was really hard for her as a midwife to see, all of the pain that they were in with the sutures at 6 weeks versus the steam users who had no problem with it after the first week. Really incredible difference in their quality of life, really. So the midwife, after the study, after the 6 weeks was done, then we were finished with the control group. So then she actually taught all of them how to steam, recommended it for them, and gave them herbs, which was really sweet. So there's all these areas that steaming impacts, where people have issues that are which are part of the external genitalia. Also, the anus is considered part of the external genitalia, and steaming is something that people use for hemorrhoids. Okay, just a little joke. My little girl is over there, and she started giggling when I said anus. You're so funny. So anyway, so hemorrhoids is also something that in the 4th trimester vaginal steam study, we saw that your steam users had relief with their hemorrhoids, and this is one of the common postpartum uses of steaming. So there's all these benefits of steaming before you even get inside. Okay, so now let's move on up. So we got this next photo that I'm showing, and it kind of shows where the vagina ends and becomes the cervix. It starts with the it shows the vagina and the vaginal canal, and then it shows the cervix. But if you notice, the vagina, there's some debate as to whether or not steaming gets in the vagina or not. And when I say debate, I just mean like the online articles. I don't know. Don't seem to be aware of what steaming does, but I've used steaming for a long time, and one of the things that sometimes I do is I use a mirror before and after steaming. And I remember the first time that I used the mirror, I couldn't believe that it looked like an open tunnel after I had steamed. I mean, it is very open, like visibly with your eye, you can see that the steam opened up this area, whereas before it was closed, and now it's just like completely open. You can see like a tunnel, and that's what the vaginal canal looks like, after steaming. So to me, it's pretty obvious that the steaming gets into the vaginal canal and is going to be touching all of the areas around the outside of the vaginal canal, as well as the top of the cervix, right? Or the bottom of the cervix, we would call it, the part that, the vaginal canal, ends at the cervix and the cervical opening. So the steaming is touching that area. Now, what's significant about that area, this is the area that that doctors check during the pap smears. They're looking for cervical dysplasia. They're looking for irregular cells in this area. This is an area that a lot of people end up getting cancer, cervical cancer. This is an area that can have cysts. And so the fact that the steaming, goes directly to this area is pretty significant. And some of the case studies, the anecdotal case studies, have been incredible. And not only that, we have the Korean study. We have the Korean study that showed that the HPV and cervical cancer went away for the steam users for stage 1 and 2 cervical cancer, and I believe it was like stage 4 HPV. So, I mean, like, really incredible ability for the steam actually to get to these areas. And then that leads us to the uterus. Okay, so let's take a look at actually, I don't want to look at the uterus. What I want to look at is the vascular supply, the blood supply to our reproductive organs, right? So, so that's why I have this right here. So as you see, the vaginal arteries, the uterine artery, and the ovarian artery, what do you guys notice about these? They're all connected. They're all connected. So anything that you do, anytime you introduce heat to the external genitalia, look at those vaginal arteries. Those are, again, the inside of that, the vaginal wall, right? Those vaginal arteries are coming right there. All of that is going to increase any increase in blood circulation to that area is going to increase the blood circulation to the uterus and to the ovaries. I think that this is the most significant and important thing to mention and to think about as to how and why steaming is impacting conditions in the uterus. I mean, the true answer, the most honest answer is we don't know. Nobody has studied it. Nobody has studied it substantially. There's no study that anybody can show that somebody is going to say, oh, this study proves this, So at the end of the day, we don't know. But what we do know about the anatomy shows that the steaming the vagina, steaming the external genitalia is going to increase the heat, the warmth to that area, most likely increasing the blood circulation, which is then going to increase the blood circulation throughout the uterus. And so the way that steaming most likely is working is by increasing the blood flow to the, internal and external genitalia, the vagina and the uterus, and increasing its own ability to function optimally. Okay. I think that is probably a very well accepted answer. I think that's an answer that is probably very well accepted, has been well accepted. That said, I actually do think that there are cases where steaming might be getting into the uterus directly. For example, with postpartum steaming, we have midwife Mary here, and I don't know if you want to, verify what I'm saying, but the cervix is still open. It takes a while for the cervix to close postpartum. So when somebody's steaming postpartum, you kind of got a shot. You have a shot of it going straight up into the uterus because the cervix takes time for it to close entirely. And I think that might be one of the reasons why steaming so soon, thank you, Mary, she says that's accurate. I think that might be one of the reasons why steaming so soon postpartum is so effective. So for example, I had 3 fibroids that I didn't know about until I was pregnant. And I found out about them after the ultrasound. They said, okay, you're pregnant. We think it's a boy. They were wrong. It was a girl. And you've got 3 fibroids, I was like, oh my gosh, and so I did my postpartum steaming. And by the time I went back for a checkup, my doctors wanted to wait and watch these fibroids. There were no fibroids there. And I think that they came out during that postpartum steaming, That's my answer. I think that the steaming is increasing the circulation to the external genitalia, and that in turn is increasing the circulation to the uterus. And that's why you have steaming impacting situations in the uterus. Okay. Now, I do want to share, again, more anecdotal information. Sometimes after steaming, somebody will notice or report that they have brown blood or black blood can come out, or a clot come out. Now, this is when they're not on their period, somebody steams, and then the next day or a few hours later, they have brown blood, black blood, or a clot that comes out. What does this indicate to you guys? Because to me, it indicates that the cervical os, like the opening of the cervix, opened, and that some old blood or a clot was sitting in the uterus and they now came out. So to me, that's an indicator that, again, I don't know if the steam went in there and pulled that out, but it was an indicator that the steam at least opened the cervix enough and created enough, movement to get that thing out. Whatever that thing was. Okay. Yeah. So in conclusion, I believe that the increase in warmth and circulation from steaming releases stagnant blood. It creates an emmenagogue effect, especially during the next uterine cleanse. So again, the steaming increases the circulation, but then what people often report when they have their next period after steaming is they report a lot of old stagnant, blood coming out, brown blood, black blood, clots and so forth. So people seem to have an increase in the uterine cleanse that happens afterwards. There's also, if there's old, menses that comes out, then I think that probably also improves the uterine lining. There is a hormone feedback loop and a menstrual cycle feedback loop that is related to the hormones that are in the mucosal barrier on the uterine walls. I hope that I'm getting this right. I did take an anatomy class to try to, learn more, where I got to learn a little bit more about this stuff. But those hormones are part of a feedback loop, and that feedback loop there's some relation in this feedback loop with the uterine lining in the interior walls of the uterus, as well as the inside of the vaginal canal. So anything that's touching or stimulating these areas or cleansing, like any old stagnation or old blood in these areas, is going to be then resetting that hormone loop. People do report improvements to their hormones, and this is, I think, one of the things that gets completely ridiculed. But when you really think about it, it's not because there's no introduction of hormones. This isn't artificial hormones being introduced or anything. But what happens is that there is an improvement in how the uterus itself functions by getting rid of stagnation and old blood, and also stimulating these areas and improving the circulation in these areas. I think that is actually why people see a difference in their hormones as a result of steaming, okay? And then in other instances, with birth workers, steaming can be used to release placentas that are retained or stuck, right? So if somebody gives birth and then they steam, or the placenta is not coming out, steaming can be used, and the placenta is released very easily in that case. So again, this is the steaming, however it's getting to the uterus, it's definitely impacting what's going on in the uterus and able to clear things out as a result, okay? So steaming is also appears to be an expectorant, which means that it's releasing mucus. And again, for birth workers, this has been shown, this has been seen anecdotally, that when somebody is, in labor or pre-labor and they steam, that the mucus plug itself will come right out, into the steam pot sometimes. Sorry for those that aren't birth workers, that is, too much information. And then the same can happen with people who use steaming. So steaming, sometimes when people steam, one of the things that happens afterwards is that they see mucus come out. And sometimes people mistake this and think that the steaming caused them to get an infection. Steaming didn't create that mucus. The steaming pulled the mucus out. It's an expectorant, okay? It also appears to be a natural lubricant or increase the lubrication. Sometimes people have they report a lot of fertile nectar, the fertile cervical mucus that happens. When people start steaming, they notice more of that. And so I was talking to a microbiologist about this, and he was saying that it probably is stimulating the production of, he was saying there's one bacteria in charge of, that. And so he was saying the steaming must be stimulating the production of it. Very fascinating, very interesting. These are, again, a lot of questions that we don't exactly know the answer to, but we can just look at the anecdotal evidence and think about it a little bit. And then steaming causes pain relief. It relieves fixed pain. So sometimes people have ovulation pain or cramping around ovulation, for example. If somebody steams during that time, they have pain relief. It stops, it relaxes everything, and the pain goes away. It relieves labor contractions. During labor, when people steam, they, it appears to help them manage the pain much better. And then sometimes it also helps to increase the contractions, stimulating that labor, which again might be because of that increased circulation. Okay. And it looks like most people have to go. Oh, Michaela is, how can we talk about the herbal properties of the plant material we use interacting with the uterus, or maybe through the vaginal mucosa? Would it be the plant oils entering the circulatory system? So that's a great question. I do have some information about that from a microbiologist. that I was going to share with you guys. But I have this problem. I always have so much information to share, and I just can never do it in time frame. A microbiologist that I was speaking to, Dr. Christine Tara Peterson, says about the herb absorption. Here it is. The vagina is a highly vascular organ. So like any other mucosal route of drug administration, drugs are absorbed via transcellular route and paracellular route. And the two main steps for the absorption of drugs in the vagina are the drug dissolution and the vaginal lumen, in which there is oxygen, and the membrane penetration. These sorts of details, I think, are important when it comes to vaginal steaming. And specifically, she was talking about dispelling a lot of the myths out there from the skeptics who are talking against vaginal steaming. I don't know if you guys have seen the articles on Google, if you've ever Googled vaginal steaming, but there's always an article about some doctor's medical opinion. And they say cleaning the vagina is unnecessary. This perpetuates the belief that women are dirty, which is not why we're, there's no evidence that the herbs can penetrate vaginal tissues, balance hormones, or improve fertility. Steaming would breed infection, or, basically would expose people to higher rate of infections and throw off the pH. Again, the actual studies that have been done, both of them were on this, and neither one of them, even though they were trying to prove this, neither one of them got their results. They did not find this to be true. Steaming could mess with the delicate, healthy bacteria, causing infections. I think that India study is really good because they showed that people had the same bacteria before and after steaming, and that it didn't cause any problem. And then, in fact, the steam group in that Indian study, their pH was at a healthier level, quite drastic difference. They had a much healthier pH than the non-steam users. So it was pretty interesting. So anyways, I was going to go over these skeptic arguments, because I think when interacting with doctors often hear these first. And so it's important to know, kind of like what they are and kind of what the responses are. But that's why I went over the models of Steamcare and the research that exists, because that research already disproves everything that the skeptics are saying, except for the one about steaming is a burn hazard. Steaming is a burn hazard, just like learning how to cook or learning how to do any other medical procedures that include heat, whether it's using a heated blanket or, a hot water pack. People need to, the practitioners need to make sure that they don't burn, the clients, or if you're doing it on yourself, you need to make sure that you don't burn yourself. Do you know what I mean? Like, steaming is a burn hazard. There are people that get burned, every day from, cooking, and with steaming, same thing. Anytime you're using steam, you got to be careful and not burn yourself, but obviously we can learn how to do this. We can learn how to wash our hands without burning ourselves. We can learn how to steam without burning ourselves. So always test the temperature. And I think it is a good idea to work with a certified steam practitioner who, has already learned how to control the temperature and make sure that it's going to be comfortable. Okay, so Melinda is sharing. I like Michaela says, amazing. I love this. Really sweet. I'll send that quote because I think it was a really good one, and it was in a private meeting that isn't published. Melinda says, I'm in an herbalist community, and someone asked about steaming. I gave a few of your points about steaming, and the woman who runs the group deleted my response. No. And said steaming was cringe and problematic and closed down the comments. Wow. Yeah. Sadly, we're dealing with a lot of ignorance, a lot of ignorance out there. And, I find that there are just a lot of people, there's just people who have that initial response, against steaming. Like, I don't think that there's any conversation that can ever be had with them. But I think, what I'm noticing for a lot of doctors and medical professionals is they just don't know about it. They don't know enough. And so they need some good information. And so that was, the point of doing this talk, to kind of speak to medical professionals about it, because I think the more that medical professionals understand about steaming and aren't threatened by it, and understand that there is no evidence that steaming causes infections, destroys pH balance, or harms the vaginal microbiome. Those are kind of like the three that I really see over and over again. I think the more that doctors and medical professionals understand that, the more they'll accept it. I mean, look at that study that was done about seeing if steam users have a higher rate of chlamydia. What do you notice? The steaming study was done in Suriname, looking at ethnic groups in Suriname and their use of vaginal steam herb use. Like, this is something that people use around the world, women use all over the world, right? And so, for doctors to be interacting with it as, oh, what are those Black women doing? We need to tell them to stop. It's kind of inappropriate. Doctors need good information about steaming so that they can offer more culturally relevant care. So I also talked to over the past year, I got to visit. So I'm actually here in the Pacific Islands right now, and the doctors here, steaming is done in the families. It's done postpartum, and there are steam practitioners who come. The family will hire a steam practitioner to come and attend to the steam care of each mom. And the steam practitioner works with the mom for like 6 weeks. And they have really incredible results as far as postpartum healing. And the doctors know that there's going to be a cultural steam practitioner, and they don't ever negate it. They don't tell people not to do it. They don't give people scary information about it. It's something that, works in tandem with conventional medicine. It's not something that needs to be opposed to it at all. It's there's a couple statements of truth, which is how one of my colleagues, Dr. Stephanie Yan, mentioned. She said, this practice is already worldwide. It comes with the power of ancient knowledge. It's been practiced since the beginning of time. This is popular medicine. This isn't clinical medicine. It's popular medicine, right? It's been with us for a long time. She says, people are already doing it. It's a popular practice that medicine needs to then learn about and catch up to be able to understand better, right? Clearly, women aren't doing this if it's harming them. I'm not steaming, I steam a couple times a month and getting an infection every time after. I've never got an infection or a burn as a result of steaming. And I've probably steamed, more than anybody. So that's where, again, so medical practitioners, doctors, nurses need to understand why people are doing it and what the results are. And at the end of the day, if it works, it works. For me, I think it healed my fibroids. I think it helped me go into labor without needing medical induction. I used it with one of my little girls to help with a paraurethral cyst. For me, it's working, right? And so if it works, it works. If there's no harm, then people should be open about it, especially medical doctors, so that they have an open communication with their patients instead of their patients wanting to hide it or be ashamed about it. Like that example of being shut down in a group, even just for mentioning it. Like, that's something that happens at the doctor regularly in the United States. In the Czech Republic, actually, when I was talking to doctors and I mentioned that there was opposition, they were surprised. They were like, why? And then I had to explain why US doctors have opposition to steaming. And that was a weird conversation. That was a weird turn of events for me to try to be explaining when there's not any justification for it. Like, steaming hasn't harmed. There's one, if you go to PubMed, there's one case study of somebody who showed up in the emergency room and had been burned as a result of steaming. But it was a very strange case. I've read this case multiple times. I think that there was a language barrier, to tell you the truth. The person who was being treated, I don't know if they spoke fluent English. It seems like they did not. So I don't even know if they have all the information about why this woman got burned. And secondly, they said that she could not feel the heat. So she must have had, again, which is a possibility. Sometimes people have a numbness or a reason why they have no sensation. But sure, somebody steaming who has no sensation and cannot feel heat, yeah, they might burn themselves just the same as, any other situation with heat. And this is something that we should watch out for and be careful for as practitioners or as steam users. If you cannot feel heat, then you should probably use a temperature, to make sure that it's a comfortable temperature, maybe 100 degrees or 101 degrees and no hotter, right? But it was a very strange case, and it gets used over and over again in the media that, somebody got burned because of steaming, and therefore it's not recommended. But anyways, if it works, it works. For the majority of people, it's working and it's not causing any harm. And so doctors cannot any longer deny that this is something that people are receiving benefit from their patients, right? And that they're seeing results on some of the things that they are going to their doctors for. So in other words, it's something that is working in tandem with the care that they're receiving and having good results that their patients are satisfied with, or might be looking for if they're not satisfied with the options of surgery or pharmaceuticals, or if those things they've already tried and they haven't worked for them. Okay. And then lastly, there are limitations to what is being funded and what is being published. I've got studies, I design studies all the time. Let's take fibroids. Let's take a group of women with fibroids, and let's have a control group of people who don't have fibroids, and let's steam this group, and we'll look at ultrasounds before and after. The same with vaginal bacterial vaginosis. Let's look at a comparative analysis of what's happening in the Czech Republic versus from the patients who choose to use steaming versus the patients who don't choose to use steaming, as far as what interventions they are having. Like, there's all kinds of things that we could do, but there isn't funding for this kind of thing. When you look at what is being funded in women's medicine, almost all of it is pharmaceuticals. So that's the reason, was the reality of why we don't actually have more information about steaming. And then in Korea, one of the interesting things I found out was that the Korean government was giving grants to people to study traditional Korean medicine. And that's one of the reasons why all of those studies exist there. So cool and so interesting. And I didn't talk about the herbs, but in general with doctors and nurses, I don't even recommend herb use. Just as long as they know enough about steaming to understand how it's being used, how it's benefiting people, and they can refer. If somebody asks them, should I try steaming? They should just say, oh, I don't know. I'm not a certified steam practitioner. But you should talk to one, further about it for this condition. Like, to be able to say, I don't know, or to know that steaming could help for something, or I've heard of cases, anecdotal cases where steaming was helpful. Here's a referral. That could work as well. And then, of course, there are cases where in the US, there's only a handful, but there are cases where OBGYNs either refer directly out to steam practitioners or integrate them into their practices. So I know of 3 practices like that so far, and it's just going to continue to grow. Okay, y'all are wonderful. I'll be seeing you guys again soon.